Started then. All right. Will you start with a brief explanation of what a travel social worker is?
Okay, so it's similar to travel nursing, and it's where you do contract assignments. So you can do contracts as short as 4 weeks or as long as 1 year. Um, and if you stay on a contract longer than a year, then it affects how you're paid, which is your per diem. Per diem is the tax-free portion of your pay that you don't pay any taxes on. So as long as you're not in a contract longer than a year, then that per diem amount remains tax-free. So it's where you basically go from assignment to assignment, state to state. Some assignments can be in the same state at different facilities, um, but the per diem portion, you have to go 50 miles or further away um, for it not to be included in that year calculation.
Oh, okay. Yeah. Thank you. Um, how long have you been a travel social worker?
Since November 2015.
Pretty recent then. What is your experience or background prior to becoming a travel social worker?
So I've been in the field of social services or human services, social work for over 20 years.
Oh, wow.
I've worked at various levels of government. So I've worked at city level, county level, and state levels of government. I've worked in hospitals, schools, and then I've worked for nonprofits. And I've done everything from working with infants, newborns, to working with geriatric patients. I've worked in mental health. I've worked in the detention system. I was working for the state of Michigan. Um, and there I worked different levels and different programs for the state. And then I've worked in different hospitals and doing different things as well.
Um, what level of education does a person need to become a travel social worker?
You need to be at least a master's level. There are a few very rare times when facilities or schools will accept a bachelor level. Usually it's a school, not a hospital. And it has a lot to do with the billing, um, and then the billing, the fee for service, and then the population that you serve. But primarily they prefer that you're a master's level with at least 1 year experience.
How many years post grad does a person need to be a traveling social worker?
At least 1 year if you're going to do travel social work is predominantly hospital, acute settings, or home health, rehab, or outpatient, but there's also some school social work positions. But for all of those, they want at least 1 year post grad.
What kind of experience does a person need before becoming a travel social worker?
So it depends. If they're going to do anything in the medical setting, so if they're going to work in an acute setting, meaning inpatient hospitalization patients, or behavioral health, if they're going to do outpatient services, so where they go to the homes, or if they're going to do like home health, so they need to have experience in those areas. It's very helpful if you have some type of medical background or knowledge about at least medical terminology, discharge planning, if you're familiar with skilled nursing facilities, long-term care facilities. And then if you're going to do school social work, then they want you to have experience in education. So either it depends on what you're going to do. I've done some secondary, but then I also did a program. Um, I'm from Flint, Michigan, so we have a huge water crisis going on. And so, as a result of that, last year I went back home and did a contract for 4 months to work with kids with cognitive delays because of the water. So they were ages, it was our Birth for Five program. So they would like for you to have experience working with the demographic that you're going to serve, basically.
Yeah. Okay. What type of social work theory helps guide your practice as a social worker?
Um, I think the main thing is having patient centered, patient focused. because we get so many different types of scenarios in the hospital that it's just important to make sure that we are keeping the patient, and the patient in the hospital includes their families. So it's not just the individual patient, but it's the entire social network. So it could be immediate family, their nucleus, or it can be extended family and those other social supports. So having a patient-centered model is more important for us, especially for me, because I can't do anything without the support of the family and the people around the patient, and then the patient themselves doing what they want is always important.
So I've heard a lot about motivational interviewing and read that motivational interviewing can be a helpful tool in helping patients or clients draw on their strengths to make desired changes in their lives. Do you use motivational interviewing with your patients? If so, how?
We do. It's so hospital social work is a little bit outside of the box of what society or many people in society view as social work. Because a lot of times when people think of social work, they think of people working in at-risk communities or working with at-risk clients on substance abuse, low income, those types of things. So we get all of that in the hospital, but we have to remember that they're there because of a medical problem. In most cases, we do get a lot of homeless, and then we get those that have mental health or substance abuse issues. But the primary focus is generally they've been admitted because they have a medical. So sometimes motivational interviewing is important and it's helpful in situations like we might get a patient who would rather go home but really needs to go to short-term rehab to get their strength back. So we can use it then to help them see the benefits of going to short-term rehab versus going home alone, and then risky readmission. So there are times when it's very helpful, and that's when we use it, is when we need patients to better understand their discharge plan and what's going to be more beneficial to them.
Jumping around a little bit, are there
That's okay.
drop-in social work positions for people that are not interested in medicine and like hospital settings?
Oh, yeah. Social work is such a vast field. The beauty of it is that you can, at the graduate level, you can study to be either a clinical social worker, meaning that at some point you're going to want to work with mental health populations and provide those clinical services. You may even want to go off and do independent and be a private clinician where you can provide therapy services independently or through a network of other colleagues. But there's also macro social work for those people that like to work with policy um, and work in changing the laws. Some people don't know that that's available, but it is. And I've worked on both sides of it. And so one of like my favorite jobs that I had before when I worked at the state was going. Um, we would do Medicaid and Medicare processing for individuals, but like say they got denied and they wanted to appeal that process. So understanding those laws and understanding the regulations and the things that how Medicare works and the EMTALA, which is basically the Medicare guidelines. So that component of social work was very different because it involved me going to court a lot, participating in hearings, testifying. So there's so many different avenues. There's again we talked about school social work, but you also have like children's protective services where you work with foster care, um, and you have family reunification programs and different things where the goal is to try to keep families together, but sometimes that's not possible. So then you have to help those children to get into safe environments so that they can still have an opportunity to have successful outcomes. So there's so many different opportunities for social workers outside of the hospital.
What type of therapeutic interventions are used in your job?
In my job, we don't really. So I typically work med surge. So I'm what you would call like I do trauma social work, and then I do like med surge. So those patients that are coming for surgeries, ortho cases, I do cardiac. But Allie, is one of my colleagues here in Maui. She works in our what's called Molokini. So Molokini is our behavioral health program. So she does a lot of cognitive behavioral health theory, and so she does a lot of group. She do individual and individual sessions and then group sessions. So for her, that would be something more that she does. For me, I don't really get into that too much because I'm on a different side of it and I'm not really doing any individual or clinical work with the patients.
A few years ago, my brother, an RN, was boasting to me about how he can travel and do what he loves, which made me quite envious. After cutting the idea of nursing out of my life because I almost fainted at a blood drive in high school, I was introduced to traveling social work when I googled whether there were travel options available for social workers. Helping people who need an advocate or helping make a life better while having the opportunity to travel to various places across the United States is truly a dream job. But there was so much that I didn't know about becoming a traveling social worker, so that's why I decided to contact my mother's coworker, Ayana. After the interview, most of my unanswered questions were answered. Not only did she teach me facts about traveling social work and how to obtain a job, she also taught me about different types of social work theories and how to apply them to not only patients but my real life too. She also touched about different therapeutic interventions she used towards patients. Like Ayana, I plan on fast tracking my MSW and working in a hospital after I graduate. After I have enough experience with that, I plan on becoming a traveling social worker just like Ayana.